Dr. Andrea Schnowski from Freedom Chiropractic and Holistic Health in the Peoria Metro Center and our YouTube channel, Health and Horsepower. This week, I am coming at you to tell you a little bit more about headaches and hormones and how they are connected. So really, when it comes down to it, when we look at hormone balance, there's many different factors we need to look at. So we can have hormone imbalances of our female and male hormones. So that's going to be progesterone, estrogen, and also testosterone levels. If those are out of balance, that can cause issues not only with like joint laxity, where joints move and can get irritated a lot faster. It can also cause issues with muscle loss, where we're not able to rebuild that muscle to stabilize joints. And it can also cause some issues with blood flow and muscle tension as well. So if we have more male-female hormone imbalances, that can cause some problems with more joint stability, muscles, ligaments, blood flow, and that can actually cause problems with headaches because the joints are moving and getting irritated, the muscles are tightening up and restricting blood flow, and blood flow issues can be a huge factor for headaches. Another possibility too is if we're under chronic stress for a long period of time, whether that is due to just mental, emotional, financial stress, or we have inflammation in our body from health issues or chronic pain that could be a factor. All of those things tend to stress your adrenal gland, and your adrenal gland actually affects the HPA axis. That's your hypothalamus pituitary adrenal gland. So that is going to be your mood. So that can affect depression, anxiety. We can also see our pituitary function affected. So those hormones I mentioned previously, estrogen, progesterone, testosterone, as well as ovary and testicular function and fertility. And then the adrenal gland is your stress response gland. So when the adrenal aspect gets stimulated, your adrenal gland has to kick into gear to help you deal with whatever stressors are in your life. So if we have low blood sugar, your body will actually break down muscle to give you blood sugar, to get sugar to deal with whatever situation. Like, for example, if you were being chased by a bear, that stressor, you would have plenty of sugar in your muscles to help you run away from the bear. Now, if we are under, like I said, chronic stress from health issues or inflammation in our body, that is going to cause our body and our adrenal gland to be kind of at a heightened level for a long period of time, where eventually, if you're running 100 miles an hour, over and over and over again, you're going to start running out of gas, and you're going to notice that your body starts to break down. Your engine that gets you going and keeps you running on the track 100%, running 100 miles an hour, starts to slow down because you run out of gas. And eventually what can happen is if that adrenal gland is kind of relied upon to work at 110% all the time, as it starts to work inefficiently, as it starts to steal away hormone precursors from other systems, we can see everything from like depression, anxiety issues, we can see sleep issues, we can see mood instability, we can see fertility issues, we can see problems with immune function and autoimmune conditions. I've had a lot of patients that have digestive issues as well, but there's many different factors and things that can be affected. So if that adrenal gland is overstimulated, it starts stealing away from those other systems. Eventually, if it runs out of resources, we will actually see where the gland itself becomes damaged. And then it's not working how it's supposed to. It's not able to produce that cortisol at the level it needs to be. Typically in my office, I recommend doing more salivary hormone testing during specific days of the month to check not only adrenal function and making sure cortisol levels where it needs to be at the proper time of the day, making sure everything's where it should be, but we can also take that a step further looking at estrogen, progesterone, testosterone, the bioidentical bioavailable numbers, so not just you have estrogen, but you have estrogen and this is the amount that's working and it's doing its job and it's balancing out progesterone levels as well. But we can even add on melatonin levels. So if you're having trouble sleeping, we can make sure that your body is making melatonin and making enough of it in case you do need supplementation rather than just a sleep aid if that's not working for you. So if you have any questions, definitely give my office a call, but keep in mind that headaches can be contributed to by hormones. And those can be a multitude of different hormones and can be affecting. So if you need information, give my office a call or go on our website, freedompeoria.org. Plenty of our contact information there, or feel free to comment below. Have a great day.